Breastfeeding. Breastfeeding is one of the most natural, one of the most lovely gifts that you can give to your baby. We're going to talk about some of its benefits, both for you and for the baby. It's just a wonderful thing that you could do for your baby. So breastfeeding is associated with a lot of challenges. There's a lot of, it's something that's not natural. It's not something that you're born learning how to do. It's not something the baby learns how to do. A lot of times you need some education in how to learn and how to teach your baby how to breastfeed. The good thing now is there's multiple internet sources that you can go to, things like the Bump, Medline searches, or La Leche League, that will give you a lot of information about breastfeeding. The key is also learning a lot of this before you have this crying 2-day-old in front of you. Go take a breastfeeding class. A lot of hospitals have that. You can take the class before you deliver, when you're nice and relaxed. And when you deliver your child, a lot of hospitals offer some type of breastfeeding teaching. A breastfeeding nurse can come to your room. I'd give you some instructions on how to breastfeed. Again, the benefits are so great, both for you and your baby. So get education before your baby's born. Get some education while you're in your hospital. And know that a lot of hospitals, I know I did this. I went back to the hospital where I delivered probably every other day just to get my baby checked out, have the baby weighed, reassure me that what I was doing was the right thing, that my baby was being well fed and was growing. So there's a lot of encouragement out there for women to breastfeed. There's a lot of support groups. And so you're going to find that it's pretty easy to find someone to get education from and support groups. Talk to your physician, talk to your hospital, and you're going to find a lot of support.
The experts have a lot to say in this regard, and the experts range all over the place. The American Academy of Pediatrics has a section on breastfeeding. The American College of OBGYN weighs in. The American Academy of Family Physicians. There is an Academy of Breastfeeding Medicine. The World Health Organization. The United Nations Children's Fund. This is international, and they all recommend the following. Children should be breastfed only, receive mother's milk only for the first 6 months of life. No water, no milk supplements, nothing. Just mom's breast milk, except for perhaps vitamins, minerals, and medications in addition. But otherwise, mom is enough. And mom is enough. It leads to many things. We'll talk about the list of things it does for both the mom and the baby. But this leads to things including the likelihood that you will continue to breastfeed beyond that 6-month window, as far as a year and even further sometimes in breastfeeding your baby.
So what are the benefits? The American Academy of Pediatrics put together a list of the benefits of breastfeeding, and most of them have to do with kind of decreasing the infectious diseases that kids may be exposed to. It'll either prevent them from getting them, or if they get them, they're going to have it a little bit shorter period of time. Things like bacterial blood infections, diarrhea, respiratory infections, middle ear infections, urinary tract infections. All of these have been shown to be decreased in babies who are breastfed. Significant improvement and significant benefit for the baby is found for babies who are breastfed.
Several other things as well. And this is all related to a complicated list of interactions or things that you may be giving to your child. But the sudden infant death syndrome is less likely in children who are breastfed. Infant mortality is less. The risk of developing diabetes or obesity is less in children that are breastfed. Less likelihood of developing asthma, which can be really problematic in kids. 1% to 2% of children across the country have problems with asthma. Keeps them out of school. It's a big problem. Slightly enhanced performance on tests. You want your kid to get into an Ivy League school, breastfeed your kid. And overall, certain cancers, particularly the blood types of cancers, leukemias, Hodgkin's disease, lymphomas, those are less likely in babies that have been breastfed. The benefits are legion, but they're not just benefits for your baby.
Right. There's a lot of benefits also for the mom who breastfeeds. One is just decreasing what's called the postpartum bleeding. So after you deliver a baby, there's normally some degree of bleeding. If you breastfeed, you actually shorten the quality and the length of the bleeding afterwards. There's more rapid uterine recovery. Your uterus has to shrink down after you deliver this baby, and breastfeeding actually enhances that kind of uterine recovery. There's less menstrual blood loss. You're going to get back to your weight, your pre-pregnancy weight. Wow,
it's a great diet plan is to just breastfeed.
It's great. There's less risk for the mom of both breast and ovarian cancers. That's a great benefit. We talked about the less risk of cancers, young kind of blood cancers in young children, but also breast and ovary in moms who breastfeed. That's a great thing. You're less likely to get pregnant when you're breastfeeding. It's something called child spacing. You don't have periods when you breastfeed, so you're less likely to get pregnant. And because your kids aren't getting sick as much, we talked about that benefit, you're less likely to miss work. So there's a huge number of benefits, both for the parent, for the mom, and for the baby who is getting breastfed. Now, just in the last few years, the American Academy of Pediatrics has come out with a recommendation that babies who are breastfed, they sometimes lack a little bit of vitamin D. So the recommendation is any baby who's breastfed, pretty much right after birth, you need to start them about 400 international units of vitamin D. It's given them to an orally, use a little dropper, talk to your doctor about it. But that's kind of the newest recommendation of the American Academy of Pediatrics. You breastfeed, you want to supplement them a little bit with a little bit of vitamin D. Talk to your doctor about it.